My specialty is joint replacement surgery, so I see a lot of folks that have been suffering with arthritis for years and years. And a lot of times folks that come in are hesitant, what are the treatment options? Is my only option going to be something surgical? What we do in clinic is we say, okay, well, let's start with some of these conservative measures to see if we can see some improvement in your overall function and a decrease in your pain. If we're unable to do that and it looks like surgery is in their future, we talk about that. There's been a lot of advances over the course of the last 10 to 15 years with regards to total joint replacement. This was a procedure when I started training. Patients would frequently stay 4 and 5 days in the hospital. And now we're able to do these type surgeries as outpatient surgeries. And we've also seen that, getting patients up early and trying to get them mobilizing early on after surgery has been a benefit in their outcomes and allowed them to get back to doing their everyday activities at a sooner date.